My name is introduced is Dr. Moses Mwangi. I am from Murang'a. I am a pharmacist who studied at the University of Nairobi, School of Pharmacy, and thereafter focused on the area of vaccines for 24 years, working in the area of vaccinology, in research, in development, in commercialization of vaccines. Many of the vaccines that are used currently in Kenya, especially beyond what we were calling KP, the 6 diseases that were there at the beginning. Many of the newer vaccines, including the vaccine for rabies, the vaccine for meningitis, meningococcal meningitis vaccine, the vaccine that people take when they travel, called the yellow fever vaccine. And more recently, we have introduced a cholera vaccine and influenza vaccine. I have been involved over many years. We didn't know about germs. And so Louis Pasteur came with the germ theory of disease. And I am a student of Louis Pasteur. I worked for his company, which he started in 1895 for 24 years. And Louis Pasteur used to say, to treat is good, to prevent is better. Prevention is better than cure. On top of being a vaccinologist, I am a born-again believer. I am an elder at Kahawa West Baptist Church, where I'm a tent maker. I'm an associate pastor. So when I'm not in the medical world, I am sharing the gospel. Okay, now Dr. Moses, who is a vaccinologist, was waiting for the vaccines to arrive in Kenya. And for me, I was going to be given the vaccine among the first people. The vaccine arrived, and we saw our CS receive it at the airport. But before the logistics could be worked out to start giving people vaccines, Dr. Moses got COVID. I got COVID. I remember it is the 24th of, it was the 24th of February. On the Monday, I gave somebody a lift in my car very early morning, and I didn't realize they were unwell. And but when I started talking to them, I realized that they couldn't talk because their throat was completely blocked. Anyhow, Wednesday I started feeling fever. I was chairing a meeting, and I realized as the meeting went on, I'm being feverish. And so I stopped the meeting and went to hospital. We did tests. At that time, we thought it was influenza, it was flu, because at the time in Nairobi, there was influenza type B that was circulating. So there was no sign of COVID at the time. My chest was completely clear. I didn't have a cough except the fever. Even the body was not very weak. But I took, I got some medicine, and I went home and isolated myself. And I told my family, now, the way I feel, I'm not sure. For me, any flu-like illness, being a doctor at that time, my mind tells me, suspect COVID, even if it is not. So I isolated myself and struggled through. Then on the 8th of March, I was diagnosed with COVID. I became positive for COVID, and went through a very difficult time. I had mild symptoms. I went twice to hospital. At some point, for 3 days, I couldn't climb my stairs in my house because I was becoming breathless. But my oxygen concentration was still good. It was above 94. So no need to be put in hospital in an oxygen. So continue isolating at home. And I was able to go through the process. and learned many lessons. Some of the things that are very important, which I had been advising, but now I can advise from an experiential perspective. There are some very important issues you need to look at when you're going through COVID, whether it is mild or whatever. And in fact, when you're going through any illness, number one is fever, because the body was very weak. You want to just sleep, fever. So you need to control fever with very simple dawas that are available in our local shops. Paracetamol of any kind, whether it's Panadol or whichever, 2-3 times a day, at least for 5 days, and thereafter as and when necessary if you're having fever. The other one is, because this is a virus and we don't have a drug to treat it, it is your immune system that fights and wins. So how can you strengthen your immunity to be able to fight? And therefore, diet becomes very important. And giving yourself vitamins becomes important, especially vitamin C. I was on 2 oranges 3 times a day. I still am, and I'm a fruit person. It's very important. But at some point, I felt I needed a stronger immune booster. And there's a friend of mine, I'm a pharmacist. We've been working with him for some time now on an immune booster called Eden Health Immune Booster, which has been tested in a number of laboratories. And we've worked together even to register it with the Pharmacy and Poisons Board. This is an immune booster that brings together a number of herbs, a number of well-known medicinal plants, but there's a technology that he uses which I don't even know. He doesn't allow me to get into the factory itself, but I have seen the good manufacturing practices that are there. And I called him and I said, look, can I have some Eden? And I can tell you, because I know it's very safe, I actually swam in Eden. Hey, I came out, as they say in the Bible, tutapitia kwa moto na Mungu atatutoa, and even smoke we shall not smell. So if you are going through a COVID disease right now, know that you can make it. But it's important to do very important things, especially like boosting your immunity, like eating the right diet, like walking around. You can make it. And now the times we are living in of COVID-19 pandemic, COVID-19 found the world already fighting other diseases like HIV and AIDS, like diabetes, which is growing at a very fast rate, blood pressure, and I think also cancer is a major issue. And as you grow older, you tend to be more vulnerable to these diseases because your immunity is going down. Although we are now seeing more and more younger people getting diabetes because of our diet or our habits, our eating habits, which are shifting to urbanized. When I got COVID myself, for a number of years I've been conscious of the need to stay healthy, and the need to stay healthy for me, part of it is getting off sugar and lowering my carbohydrate intake as I grow older, and there are many people who are growing older. Lowering your carbohydrate intake protects you against diabetes and blood pressure. And let me say a word to people in Mount Kenya region, where I come from, because we eat far too much carbohydrate, far too much. You see in our home somebody preparing ugali and the kitoweo ni ya waru. You see people preparing rice with waru or with potatoes. Potatoes have become like, you can't make a kitoweo without potatoes, and I think there is far too much carbohydrate. We need to lower that, the role of vitamins and minerals in our diet, and these come from vegetables, which should not be cooked too much, because again, when you cook them too much, you destroy the very nutrients, and that is where sometimes you see an immune booster like Eden Health, the immune booster. The method of preparation has preserved these nutrients, these vitamins and minerals, and it helps you in getting well, whether from COVID or from other comorbidities like diabetes or blood pressure, or even cancer, because your body is involved in a war. When you are sick, your body is involved in a war. It's already in war. And therefore, anything that can help boost its ability to fight, it will be able, you are able to get better outcome, whether it is with cancer, or it is with diabetes, or it is with any comorbidities, anything that boosts your immunity through the diet, or using a product like Eden Health and Immune Booster would be very, very useful in our daily lives. But the rule of folks, you are very privileged. Africa and Kenya is very privileged. We have plenty of vegetables, plenty of fruits, and many times we don't see their value. This should become part and parcel of your diet. And if you are able to have access to immune boosters, why not? At least it worked for me, and I've recommended it for a number of people, a number of colleagues and friends who have gone through COVID. Sometimes, you see like they're going down. I tell them, please, if you can, get access to a bottle or two and use it this way. And I think we have quite a number of people who have benefited from this. And this being a pharmacist, and a person who understands something we call pharmacognosy. Pharmacognosy is about the study of natural plants, and we have a number of them which are medicinal. I would say that it's something good.